Okay, and you mentioned just a number of diseases that probably can also lead to these two. You mentioned diabetes and hypertension. How do they come about?
Unfortunately, these are what are known as lifestyle diseases. They are non-communicable diseases, meaning that they do not spread from one person to the other. There's a relationship in terms of genes, in terms of age, in terms of race. For instance, we do know that the African is more predisposed to develop these things. The Asian is more predisposed than the African. And so we're talking about, we call them non-modifiable risk factors. That is age, race, gender, your genes. So those are 4 things that you and I cannot change because we are getting older by the day. But then there are risk factors that you and I can modify. We're talking about our weight, we talk about our salt intake, we talk about whether or not we smoke, we talk about whether or not we're actually active physically, we talk about whether we are sleeping, do we take alcohol, do we exercise? All of these are risk factors that you and I can modify. Drugs, we're taking any sort of drugs. We mentioned smoking and alcohol among them. So there are things that, you know, contribute towards developing cardiovascular disease.
All right, and we also talked of the other, let me say, cardiovascular diseases, and you mentioned hypertension and stroke as well. Let me say that someone has had a heart attack. Is there a chance of them probably experiencing stroke as well?
Unfortunately, yes, because stroke also talks about the caliber, once again, of the blood vessels that supply blood to the brain. So the caliber of the blood vessels that supply to the brain can begin to narrow. Usually around the neck, there's arteries that go to the brain or to the head from the neck, some from the back. So these arteries can actually narrow. That process is known as atherosclerosis, where you get cholesterol or plaque buildup in the arteries going to the brain. So when they do, you know, you're actually leading towards getting the risk of getting a stroke. A stroke is a terminal event usually involving a clot that blocks the lumen of the mid blood vessels going through the neck, or leaves these areas, goes to the small blood vessels in the brain and actually blocks them. The same process is seen with the heart, where the caliber of the blood vessels, you know, progressively gets narrow through atherosclerosis. Once again, high blood pressure, sugar, smoking, high cholesterol, all of these things are factors that could block these arteries and block these arteries. Sometimes we find clients who actually got a heart attack and then a stroke immediately after. It actually happens. Or the heart misbehaves in terms of heartbeat and sends small clots to the brain. So the main we're talking about here is narrowing of the blood vessels, either in the heart, in the major blood vessels, or the ones going to the brain, and a terminal clot that now leads to the event that presents the client.
All right. You also mentioned of, let me say, gender.
Yes.
Between male and female, who are more predisposed to a cardiac arrest and heart attack. You also mentioned of lifestyle diseases. So does it mean when I have too much weight, my chances of having a cardiac arrest or a heart attack are high?
We say that men and women, women are safer up to the age of 65 or after menopause. Postmenopausal women and men have the same risks. But estrogen provides a very good safety net for women for the period of time that they're in childbearing. When the estrogen levels go down, we get other levels going up, including follicle-stimulating hormones. These are hormones, reproductive system. When they go up goes testosterone, which is the main hormone that causes risks where men are concerned. Because testosterone drives your blood pressure, drives your heart rate, many of the things that we try and control with exercise and with lifestyle. So women are safer compared to men up to the age of 65 or up to menopause. All of us are safer up to really the age of 65, but we've noticed that this age has been lowering, so that of late we are counseling our clients to come for a checkup after the age of 40. Especially after the age of 50, we really want you to actually do get a regular checkup, watch your lifestyle, begin to do the right things that will actually keep you safe. Weight is important. By and large, we encourage men not to have a waist size more than 40 inches. Because, and I think about 35 for women, because anything above that puts you at a high risk, what is known as metabolic syndrome, which leads to blood pressure, leads to sugar, high uric acid, thyroid problems, all things which cascade into heart attack and stroke.
How about for pregnant women?
Pregnant women are a special category. There are a few risks that they do have, but heart attack and stroke are not major there unless their hearts already have structural problems. You get patients who actually already have heart disease, getting pregnant, then it's a compounded situation, because in pregnancy the volume of blood does increase by 40%.
All right, I'll just get to take one question here from Ali Debo Hassan. That's on Twitter. He's asking, a good morning, Dr. Nduiga and the viewers of CAC TV. My question is, when can a patient diagnosed with heart attack resume with normal physical exercises?
If you're treated, first and foremost, you must be treated and treated adequately. We must have identified what caused the heart attack and taken care of it. Usually we allow you 2 weeks. 2 weeks is usually sufficient. Of course, we highly recommend that you meet your doctor. He assesses you. There are some tests we do to assess the function of the heart, to assess how you're doing, assess the level of inflammation. Usually 2 weeks is sufficient. Most of my clients resume work in about a month. Within about 2 weeks, I allow them to go about daily business. And really within a month, they are normal.
Okay. I hope, Ali, you've been able to just get your response on that. And my other question will be, you also mentioned other risk factors being drugs.
Yes.
A number of Kenyans, probably I'm also one of them, we have the habit of just going and acquiring drugs over the counter. And for these patients that have diabetes and hypertension, among other non-communicable diseases, they are also on other drugs. So what are the chances of these particular drugs that we are taking ending up probably causing heart attacks or cardiac arrests? And what can be done?
The drug I'd like to highlight where this age group is concerned is actually drugs known as non-steroidal anti-inflammatory drugs. The best example of this would actually be brufen. Other examples I would give is diclofenac. I'd give an example of diclofenac, brufen, aceclofenac. These are drugs, maramoja also falls into that category. These are drugs that we buy a lot over the counter because of pains. Because these clients generally have joint pains, they have back pains, they have pains of some sort that they want to sort out. So you find a client taking brufen every single day, diclofenac every single day. These drugs do carry a higher risk because they increase your blood volume, increase salt in your body, increase your blood pressure, put you at higher risk of getting blood pressure and stroke and kidney problems. So that's one category I'd like to highlight. For younger viewers, I'd like to point out that cocaine has been known to cause heart attack. And unfortunately, cocaine is easily available in our streets. And especially the injectable does cause heart attacks. So please be alert that not everything you put through your mouth or you shoot down your veins is safe for you.
All right, thank you so much for that. I think we'll be taking a very short break. We'll just be coming back with more. That is with Dr. Daniel Nduiga.